Med Ed Bytes, micro, just-in-time education. Hi, this is Dr. Ria Temmerman, CRNA scientist and co-founder of Atomic Anesthesia, and I'm here to guide you through this Med Ed Byte. In our series of postoperative cognitive disorders, we'll focus this lesson on assessing and identifying patients at risk for postoperative delirium and postoperative cognitive dysfunction. To do this, we use a comprehensive approach that utilizes various screening tools and evaluations of risk factors. Several cognitive screening tools are commonly employed in preoperative assessments, including the MiniCog, which is a rapid 3-minute test consisting of a 3-item recall and a clock-drawing task. The Montreal Cognitive Assessment, MOCA, is another valuable tool, providing a more comprehensive evaluation of multiple cognitive domains in about 10 minutes. The Mini Mental State Examination, MMSE, is also widely used, assessing various cognitive functions in approximately 10 minutes. Additional tools such as the Short Blessed Test, Clinical Dementia Rating Scale, and CANTAB MCI can be utilized for more specific or detailed assessments. To identify patients at risk for POD and POCD, several key factors should be considered. Advanced age is one of the most significant risk factors, with individuals over 65 years old being particularly vulnerable. Pre-existing cognitive impairment is another critical factor, as it may be regarded as equivalent to ASA4 status. A thorough review of medical history is essential, looking for conditions associated with higher POCD risk, such as cerebral, cardiac, and vascular diseases, along with a history of alcohol abuse. Educational level also plays a role, as lower educational attainment has been linked to increased risk. The type and extent of the planned surgical procedure are important considerations, with cardiac surgery and certain orthopedic interventions being associated with higher incidence rates of cognitive dysfunction. Additionally, the expected duration of anesthesia should be assessed. Longer durations have been shown to increase the risk of POCD. A medication review is crucial, particularly regarding the use of anticholinergic drugs that can heighten the risk of cognitive impairment. Other factors to consider during assessment include overall health status and frailty, as these can influence vulnerability to cognitive decline. Screening for sleep disorders such as sleep apnea is also important, given their potential impact on postoperative outcomes. Nutritional status should not be overlooked either. Poor nutritional health can increase susceptibility to cognitive decline following surgery. For postoperative assessment of POD, the Confusion Assessment Method, CAM, is commonly used and is often administered daily in the immediate postoperative period to monitor for signs of delirium. It is vital to recognize that preoperative cognitive screening may have limitations, including potential biases and varying sensitivity and specificity across different tools. Therefore, a multi-specialty approach involving prehabilitation, physical medicine and rehabilitation, gerontology, anesthesia, and surgery is recommended for patients displaying signs of preoperative neurocognitive decline or dementia. By integrating these assessment tools and evaluations of risk factors into clinical practice, healthcare providers can more effectively identify patients at higher risk for POD and POCD. This proactive identification allows for tailored perioperative management strategies aimed at mitigating these risks and improving patient outcomes. Done. Medtronic, engineering the extraordinary.